Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. I'm so happy today because it's the first time we are discussing something different, which is diabetes. And on today's episode, please join me to welcome Dr. James Success Odubia. Did I
Yes.
pronounce your surname right? Odubia.
Yeah, Odubia.
Okay.
Thank you very
Welcome on
much.
board, Dr. Odubia.
Thank you very much for having me on the show, ma. Thank you. I sincerely appreciate this.
Thank you so much for accepting the invite. It's an honor to have you on board. Thank you for making the discussion before bringing you on board. Thank you for making it easy for me. Um,
No problem.
Today we are looking at the comparative effectiveness of ranibizumab and bevacizumab on the treatment of diabetic retinopathy, a systematic review and meta-analysis. Before we go forward with discussion, you know how we do it. We let our audience know about our guest researcher. Dr. James Success Odubia is a dedicated researcher with a strong commitment to advancing public health through health promotion and evidence-based research. Currently, Dr. Odubia serves as the head of research and development at DataClear Consult. He also contributes to higher education as a lecturer and research advisor at Dove Francies University. Conclusively, he aspires to be a professor of public health. Beautiful biography. It's actually I usually say anyone who goes into research that is invested in research like you do. If you are following Dr. Odubia on LinkedIn, you will see how he shares his research publications. And for me, I feel anyone that goes deeply into research, they have an interest in academia, because for you to stay in academia, you have to like keep up publishing, like the normal saying, you either publish or you die, something like that. As if there is a common saying like that,
Exactly.
publish or die. So it's great to see that you have prospects of being a professor. We need people like you who are interested in the field and also can contribute significantly to the field. Before we start asking the question, start discussing diabetes, let's look at what people are saying about diabetes on X. The first tweet is from Professor Dr. Sanjeev Bagai. He said, once weekly semaglutide 7.2 milligrams in adults with obesity, a randomized controlled phase 3B trial, Lancet Diabetes and Endocrinology. Secondary endpoints were percentage change in body weight with 7.2 milligram versus 2.4 milligram change in waist circumference. I guess it's giving the difference before and after administration of semaglutide to whoever they gave it to. The second from tweet from is from KCAU9 News. Type 1.5 diabetes or latent autoimmune diabetes in adults is an autoimmune disease that mainly strikes individuals when they reach adulthood.
Adulthood.
They're
Yeah.
trying to give talk about autoimmune diabetes. Last tweet is from PIB Maharashtra. This is from an Indian origin.
Indian
Where
origin. Yes.
yeah, they're the ones with those names. So he said or she said, childhood non-communicable diseases (NCDs) represent one of the most pressing but under-recognized challenges of our time. The impact extends beyond hospitals for diseases like type 1 diabetes, sickle cell disease, asthma, chronic heart disease. Families struggle with recurring medical costs, frequent travel to district centers, and the stigma their children face at school and in communities. Early detection enhance capacities for frontline workers, establishing pediatric clinics with free access to essential medicines, promoting healthy lifestyle, and outreach activities are some keys to dealing with childhood NCDs. Sri Sanjay Singh, chief of UNICEF India. Okay, that was what the chief of UNICEF in India. That's what he said about non-communicable disease, which also included type 1 diabetes. So those are the tweets I got that I feel relevant to our discussion for today. And I'm glad this is the first time I'm talking with on diabetes, and you have done significant research on diabetes, and we know what diabetes is, that it can affect any organ, and we are focusing on the effects of diabetes today on the eye. So, Dr. Odubia, in simple terms, you talked significantly on you discussed diabetes significantly in the paper in relation to two drugs. One is
Yes.
ranibizumab, and second bevacizumab. So, first, Dr. Odubia, what is pan-retinal photocoagulation? Because you are using some terms in the paper, and I feel for anyone to understand what they're reading, even for you to understand these terms, you already understand the whole paper as a whole. So, what were you trying to say up on pan-retinal photocoagulation?
Thank you very, very much. Before I start, I like to also portray some of the tweets. We are in a 21st century where we are gradually leaving infectious disease behind, because irrespective of the emergence or the re-emergence of any infectious disease now, at least in one way or the other, you will have seen something to cushion it. For instance, the outbreak of monkeypox, smallpox, you will still see one or two vaccine that is kind of related, that you can easily give while you actually await the clinical trial of the new ones you'll be what is it called, that will be coming up. Unlike the NCD, that different costs, different routes, different everything. So NCD is something worth talking about sincerely, and diabetes is actually key, one of it. So that is my contribution to the tweet. And for the question you were asking about photocoagulation, apparently it is a scientific paper, and that is why there is no any other smaller name, or there's no any other, let me say, any other name we can call it other than that. That is why we would just have to leave it that way. But basically, photocoagulation is, I will try to be as simple as I can. So it's actually a kind of treatment, and this treatment, from the word photo, has to do with light. Do you get? And this is a treatment where the doctors will make light at the back, most of the time at the back of the eye. And the purpose of this basically is to reduce the eye demand, the eye demand for oxygen, number one, and also to stop the new vessels that are growing. Most of these new vessels will always be dangerous and can easily burst. So because of this, just like you are wedding up something to prevent the leakage. Do you get now? So that is basically what photocoagulation is in a layman time. Although it has two faces to it. One, it could actually, some people may actually lost their vision in that process. Then secondly, some people may actually struggle with it as well. However, it is actually very, very what's it called? Is a way of preventing leakage, and especially to reduce the high demand for oxygen in terms of how it relates to diabetic mellitus, diabetic retinopathy rather. Sorry, I'm currently working on diabetic mellitus, and I'm trying to put on basically is more of like, to a layman, a kind of weathering at the back of the eye. To number one, first and foremost, the reason for that is to reduce the demand, the high demand, high demand for oxygen, and secondly also to prevent what's it called, vessels carrying blood that can actually easily burst. For instance, like I said, it's more of a weathering now. When you wed something, you are preventing, or let me say, you are putting light at the back, so as to see that nothing goes through it again from the back. This eye particularly is actually affected by diabetes, and when doctors uses laser in form of light, which I call the photo. that is in the photocoagulation. That photo means light. So they use it to make tiny bones like that at the back of the eye. I can share my screen. I don't know, maybe some other time. So to show how it looks like. So the purpose is basically to reduce oxygen and stop the weak what's it called, new vessels basically from growing. And like I said earlier, it comes with two things. Number one, the positive part, which has to do with the reduction of what's it called, oxygen supply now to the eye. Secondly, the bad part of it is that some people in that process of lightening can actually totally lose their eye. So that is what I meant by photocoagulation.
Thank you so
I don't know
much,
if that
Dr.
is simple
Dibia.
enough to a layman.
Yeah, thank you so much, Dr. Dibia, for discussing extents. Actually, it was actually more than what I anticipated in you discussing it. Um, Please, Dr. Dibia, can you shed more light on intravitreal anti-VEGF agents? What are you talking about? What are they? What are these agents in relation to
Okay,
diabetes?
like I said again, I will be very, very simple and of course break it down to a layman. The word anti-VEGF. The word anti means an enemy of something, right? So you are introducing an enemy of something. So what is VEGF first? So VEGF basically is a kind of a natural chemical now, and in the medical or health we call it proteins, for instance now. So in the body, this is just they are natural in the body. But when diabetes damages the eye, too much of it can build up and make weak blood vessels to grow. So now, what anti-VEG does now is that it prevents and stop the swelling of these things that I just explained. Are you getting what I'm saying now? VEG is a chemical in the body, but when diabetes happen to the eye, so the it damages the eye too much, and of course it can even build up weak vessels in the eye. So what this anti-VEG does is that is an injection that is inserted into the eye to prevent this from happening. So that is basically what it is in a layman. I don't know if that is explanatory enough.
That's okay, Dr. Dibia. We know that there, in relation to diabetes, like there is the reversible form and the irreversible form. An example of the reversible form is there's gestational diabetes and pre-diabetes. But uh, I want to know, as diabetes mellitus is a complex metabolic disorder marked by chronic hyperglycemia, from your paper, I'm quoting, caused by insufficient insulin secretion or ineffective utilization of insulin in peripheral tissues. Anyone reading this, I'm a scientist, I can grasp what you're trying to say. But anyone outside the field of health might not be able to grasp what you're trying to say. What were you trying to say from this statement as a lead author?
So diabetic mellitus, you said. So basically,
Yes, on
diabetes
peripheral
mellitus.
tissues.
Okay, peripheral tissue basically they are what's it called? They are primarily to um peripheral tissue refer primarily to skeletal muscles, right? So this thing in type 2 diabetes, insulin
Okay.
resistant within these tissues reduces the efficiency of glucose. Can you hear me?
Yes, I can.
So these skeletal muscles now account for most of these whose part that uses sugar from food. Peripheral tissue are the main body part that uses sugar from food. Can you hear me? So the tissues, this includes the muscles rather, the fat, and even the one in the liver. So normally insulin acts like the key that helps sugar move from the body into the tissues for energy and leave for storage. Can you hear me? So in the
Yes.
issue of diabetes now, these tissues stop listening to insulin. So the sugar stays in the blood. So the because of this, the sugar stays in the blood instead of being used properly. So in this case, when this happen, muscles can't burn it, fat doesn't store it well, and liver keeps releasing sugar even when it shouldn't. So this explains why blood sugar remains high, number one, and causes damage in the long run. So that is the explanation of these peripheral tissues in diabetes as a whole.
Okay. Thank you so much for that. I know you talked about anti-VGF agents in previous question. Can you shed more light? Can you extend your discussion on antiviral anti-VGF therapy?
Okay, like I said before now, that they are injections, and one example of them is this ranibizumab and bevacizumab that is actually injected into the eye. So basically, this is the treatment given to like it's a direct injection, and the medicine helps to block VEGF, which I explained earlier that they are chemical natural proteins inside the body. So the signal that makes this weak leaky vessel growth. So by calming down this VEGF through this um through this anti-VEG therapy. Can you hear me, please?
Yes, I can.
So by calming it, the eye swelling goes down, number one, and of course it stops leaking. So that is basically the whole idea revolving around intravitreal anti-VEGF therapy.
So, is there any difference between the agents and the therapy? Anti-VEGF agents and anti-VEGF therapy.
I think they are two words used in different contexts.
Okay.
When they say when we say something is an agent, for instance a disease causing agent, for instance, or a disease causing organism, that means that specificity of that thing, for instance the parasite, the so why the therapy is the process of applying that. I don't know if you
Thank
understand.
Thank you so much. Thank you so much. That's what I wanted our audience, so that they won't assume we're talking about the same question.
Okay.
That's what I wanted them to understand. So, Dr. Odubia, to the next question from your paper, the American Diabetes Association defines diabetes when plasma glucose levels reach or exceeds 200 micrograms per deciliter for 2 hours. From your paper, are there other forms of glucose in the body? What are you trying to insinuate? Are there other forms of glucose in the body?
Well, sugar in the body is not only in the blood, you get. So and that is why doctors test blood sugar, but sugar also exists in other places. Number one, there are sugar that store in the liver and the muscles as the glucogen. Cool. And I want to give an instance like a battery that can be recharged every energy is needed. Do you understand now?
Yes.
So
Yes.
the answer to that is that of course sugar, there are sugar in sugar does not only what's it called now? Sugar does not is not only found in the blood, there are other places in the body that sugar is found.
Um,
Yes.
Thank you so much, Dr. Dibia, for shedding more light on that, on the different forms of glucose and where they can different forms of glucose in the body. Um, Still on going back to VEGF discussion, because it was repeated severally in the paper. VEGF upregulation promotes neovascularization, vascular leakage, retinal edema, eventually leading to irreversible blindness if untreated.
Hmm.
Please shed more light on this.
Okay, so basically, the reason why we kept on using VEGF is because is the context of the two drugs we are trying to compare. Both drugs are anti-VEGF. So that is why we are trying to make VEGF pronounced so as to bring context to the two drugs we are trying to introduce, or we are trying to work on. So basically, when diabetes damages the eye, the body reacts by too much of chemical called the VEGF. So that buttresses the explanation of VEGF that I've said in the latter part, being a natural chemical in the body. So VEGF now tries to help by growing new blood cells, but these blood cells are weak and breaks easily. So
Okay.
the leak of this, the leak fluid and blood, making the eye swell and vision blurry. So when this happen, e make sight and vision blurry. So over time the scar tissue grows and even pull the retina off in rare cases. So
Wow.
this cause permanent blindness. So why VEGF is meant to help, too much of it becomes very harmful. So that is why many treatments aim to block this VEGF to stop these weak vessels from destroying the entire eyesight. So that is the explanation in that context.
Okay. Thank you so much, Dr. Odibia. Thank you so much. As I'm discussing with you, because I read the paper fully, as you're explaining, I'm getting more insight on the paper.
Okay.
Please paint a picture of diabetic macular edema. When they say diabetic macular edema, what is the picture that comes to your mind?
Okay. Just imagine looking through a camera lens, for instance. Using the camera lens as a eye now. So and the camera of your phone, you just see that, or you just notice that there is water trapped inside it.
Hmm.
Just imagine it that the camera of your phone, there is water that is trapped inside it. That is what diabetic what's it called, edema is like. So the macula, which helps you to see clearly, this camera will help you take clearer pictures, but now
Yes.
there is a kind of a sprinkle of water on it,
Yes.
so which helps you to see clearly and in details, swells up because this VEGF that we've been talking about since, eh, weaks body, the blood vessel leak fluid into it. In the process
Yes.
of VEG trying to protect now, so there is a leakage that drops in form of water now to the macula that is supposed to help you see clearly. So this makes the vision very blurry, distorted, just like you can no longer take good cameras with your phones, and because of the blurry of the, what's it called, camera, courtesy of the water. So the water sprinkle on that camera, the water is now the VEGF, while the camera is now the macula that you are supposed to see clearly with. So that is just the
Beautiful.
scenario, a kind of a layman scenario as regard what's it called, DME, which is
Thank you so much.
diabetic
Thank
macular
you so much,
edema.
Dr.
So that is
Dubia,
it.
for that simple and beautiful explanation. As the lead author, Dr. Dubia, um, what do you want readers to derive from the statement from your paper? Proliferative diabetic retinopathy relied on panretinal photocoagulation.
You said what? So I didn't get that.
I said, what do you want your readers,
Okay.
people, anyone who comes across your paper, what do you want them to derive from this statement? Proliferative diabetic retinopathy relied on panretinal photocoagulation.
Okay, I think I'm just getting the context to the question. So that statement means that in the past, doctors, especially those that specializes in eye, only had one main way to treat these eye diseases, which is the lesser treatment, like I explained, the light trying to stop the VEGF to prevent leakage and all of those stuff. So the laser on its own saved people from going blind, but it also, like I said earlier, it also reduces side vision because in rare cases or when it's not handled by an expert, the person, or let me say the patient can totally lose his eye. So now with the injection that blocks VEGF, patients have more choices than the previous time that protects sight without as many as possible side effects than the pan the photocoagulation era. So that is basically it. That sentence actually means that in the past, doctors only had one main way, which is that photocoagulation. I don't know if that answers or clears the air about that.
Thank you for sharing your perspective on that question. I feel it was quite elaborate for our audience to understand what you're trying to say. Victronomies. I'm bringing a lot of terms because, as I said at the beginning, if you understand some statements and also some terms from the paper, you already understand where Dr. Odubia what Dr. Odubia and other authors on this paper are trying to relay. Vitrectomies. What are they, Dr. Odubia?
Well, it's not a big word as it seems, but for the sake of better words, and of course there is no any other words we can use. That is why we use that. So basically, is just like you have surgery, any kind of surgery in any part of the body and the others. So it's actually a kind of a surgery in the eye. So the eye is filled with the jelly like when I the era of VGF and the other, I think you should our audience will understand what I'm trying to say now. So in diabetes, the surgery is usually done when injections or the lesser are not enough. This anti what's it called VEGF that we spoke about. Can you hear me, please?
Yes, yes, I can.
So basically, the the victomy is basically a surgery in the eye, just like you have surgery in other parts of the body or any types of um, surgery. So that is basically the meaning of that terminology.
Thank you so much, Dr. Odibia. So far, you've explained beautifully the paper in a way that a layman can understand. One of the questions I usually ask every guest researcher in relation to their paper is um, a sentence I got from the paper in relation to the question I usually ask them is diabetic retinopathy, which is the topic for discussion today, is a global epidemic disproportionately affecting populations in low and middle income countries where former regulatory frameworks may be weak, but where the burden of preventable blindness is greatest. Where do you see the management of diabetes in low and middle income countries in the next decade?
Well, that question is deep, and I may not be able to bite all on this call. However, I'm just going to give it a scratch. I can defend the fact that in there will be improvement because of the fact that now the research find out bevacizumab as a kind of an affordable treatment, for instance. Now, so if people rely on that, we can have improvement in terms of diabetic retinopathy incidence and all of those stuff. Then secondly, another way to defend this is that we are in the jet age where telemedicine and of course AI screening is very, very visible. Do you get now? Then also
Yes.
we already have initiatives that are into these diabetics of a thing and the others in low and middle income countries. Then also we already having policy shift as well. What we had yesteryears is not what is obtainable now again. There have been improvement and the other. So with that, one can say that in the next decade there will be improvement. However, we also need to look at the other side of the coin. While we have the fascinating factor, just like I mentioned, the affordability of bevacizumab, the era of AI where you can easily do what's it called, screening even at your comfort, the dispensation of global health initiatives and all of those stuff. We also have in low middle income countries weak health systems, such that irrespective of how beautiful these initiatives are, we do not have a structure. Then also we have regulatory barriers as well, the likes of the pharmaceutical industry and the others to contend with. And the fact that we also have the rural and the urban divide, such that people in the urban have access to stores better than those people. So the question is kind of dicey when I said I can defend it to mean that okay, for instance, we can have improvement. There are also mitigating factors as well. So it's a very dicey question to provide affirmative answer to, looking at the bearing, or let me say the divide that I've spoken about. The two of them are, but I so much believe with enthusiasm that we'll have a better management of diabetic retinopathy, courtesy of the policies that are really going on at the moment and some initiatives, and courtesy of the fact that they are already laboratory stuff. There are drugs going through clinical trial at the moment that can also be very, very affordable. So that is it, man.
Thank you so much for that candid answer on where you see us in a decade's time. It's very important, and I feel what every guest researcher will have asked similar question. What they keep emphasizing is structure, data structure. What is on ground in terms of that, and what I'm optimistic. Countries like Nigeria and other low and middle income countries in the decade in respect to diabetes with the investment that is going into diabetes research, will have improvement on the continent and other continents which have countries that are in the bracket of low and middle income countries. The last question, Dr. Odubia, um, are diabetic retinopathy patients who take ranibizumab compared to those who take bevacizumab associated with greater sight improvement after treatment? I feel this question, I brought it as the last question because I feel this is the this is the crown. This is what crowns it all. If you can listen to this or watch this video as an audience and you understand this question, which the answer Dr. Odibia will give us, like you have excellent understanding of the paper even if you don't read the paper. So, Dr. Odibia, your answer.
Okay, basically, I think I need to provide a background to my response first, so our audience can get the context very well. This is a systematic review and a meta-analysis. So they are, if you read the paper, you'll see that there are some star strings that are used to pull out data and all of those stuff. And we have to, because of the scientific context to research, meaning that somebody must will be able to pick up your research now and do exactly what you said you did and get the same result. So because of that, we need to stick strictly to the inclusion and exclusion criteria for this work. Do you get? So I'm going to be providing responses um with respect to what we found out in this paper. So to start with, both ranibizumab and bevacizumab are eye injections, and what they do is that they help patients with diabetic eye disease to see better. Although there are studies that that show that this both medicine works well, and there is not a big difference between them. Do you get? So some results even suggest that bevacizumab may work slightly better. Do you get? So, but the biggest difference here, fact that ranibizumab is very expensive, while bevacizumab is much more cheaper. So because they work both the same, many doctors recommend bevacizumab, especially in countries where money is limited. Do you understand now? So in simple terms, both injections improve vision, but bevacizumab gives similar benefit at a low price. I don't know if that
Yeah.
answers the question. So that makes it more practical, a more practical choice for most patients, courtesy of the price. Since ranibizumab and bevacizumab are delivering the same result, and one end up being cheaper, so I would just go for the one that is cheaper and still delivering the same result than the one that is higher. So in the context of the this research, so that is what we were able to find out.
Thank you so much, Dr. Odubia, for giving a beautiful explanation and a simple explanation to all the questions for today. Global citizens, Dr. Odibia's paper was what we looked at during the week. It's mainly diabetes affects organs, and we looked at the effect of diabetes on eye, which is diabetic retinopathy. So if you have diabetes, or you know someone who have diabetes, or you have a likelihood of having diabetes, like family history of diabetes, this is a paper. This is a must read for you. I feel we know someone who knows someone who has diabetes or has possibility of developing diabetes. So please read the paper, read, understand it, and prevention is better than cure. Have a blessed week, global citizens.
Thank you very much. Goodbye.